Question 1. The performance metrics show a consistent delay in the release of patient discharge summaries, impacting continuity of care. As a health information management professional, you have identified that physicians are dictating summaries late, and HIM staff are experiencing delays in transcription and coding due to incomplete information. Which approach best addresses this interprofessional conflict and improves the discharge summary release process? Option A. Immediately escalate the issue to hospital administration, highlighting the negative impact on patient care and requesting intervention to enforce physician compliance with dictation timelines. Option B. Send a formal memo to the medical staff outlining the consequences of delayed discharge summaries and demanding immediate adherence to dictation deadlines. Option C. Schedule a meeting with the physicians and nursing leadership to present the performance data, discuss the root causes of the delays from all perspectives, and collaboratively develop an action plan for timely completion and release. Option D. Focus solely on optimizing HIM department workflows and staffing to process summaries faster, assuming the delays are primarily an internal HIM issue. The correct answer is C. Schedule a meeting with the physicians and nursing leadership to present the performance data, discuss the root causes of the delays from all perspectives, and collaboratively develop an action plan for timely completion and release. Explanation. The performance metrics show a consistent delay in the release of patient discharge summaries, directly impacting continuity of care and potentially leading to readmissions. This situation is professionally challenging because it involves multiple interprofessional stakeholders with differing priorities and perspectives. Physicians who dictate the summaries, HIM professionals responsible for coding and release, and nursing staff who rely on timely information for patient follow-up. The HIM professional's role is to ensure accurate and timely health record completion and release, adhering to organizational policies and provincial/territorial health information legislation, e.g., Personal Health Information Protection Act in Ontario, or similar legislation in other Canadian provinces/territories. The correct approach involves a collaborative, data-driven resolution process. This aligns with CHIMA Code of Ethics and Professional Conduct, which emphasizes professional responsibility, integrity, and the promotion of quality health information management. By initiating a meeting with the involved parties, presenting the objective performance data, and facilitating a discussion to identify root causes and develop a shared action plan, the HIM professional demonstrates leadership and a commitment to improving patient care and system efficiency. This approach respects the expertise of all stakeholders and fosters a solution-oriented environment, which is crucial for effective interprofessional collaboration in healthcare. Incorrect approaches fail to address the systemic nature of the problem or disrespect the roles of others. For instance, unilaterally escalating the issue to senior management without attempting direct resolution can be perceived as bypassing established communication channels and may create unnecessary conflict, undermining trust within the interprofessional team. This could be seen as a failure to exercise professional judgment and to attempt collaborative problem-solving as expected of a certified HIM professional. Another incorrect approach, such as blaming a specific department or individual, is unprofessional, counterproductive, and violates principles of respect and integrity. It creates defensiveness rather than cooperation and fails to identify the underlying systemic issues, focusing solely on the HIM department's workload without acknowledging the contributing factors from other departments, ignores the interdependencies inherent in the discharge process, and is therefore an incomplete and ineffective resolution strategy. Professionals should approach such situations by first gathering objective data, then initiating open communication with all affected parties. The goal is to understand each stakeholder's perspective, identify common ground, and collaboratively develop actionable solutions that are sustainable and beneficial to patient care and organizational efficiency. This process requires strong communication, negotiation, and problem-solving skills, grounded in ethical principles and regulatory compliance. Question 2. Stakeholder feedback indicates a desire to expedite the coding process for complex inpatient cases to improve turnaround times. A group of coders has proposed a strategy of assigning the ICD-10-CA code for the principal diagnosis based on the physician's initial assessment, and then applying the most commonly associated CCI code for the procedure, without a comprehensive review of all physician notes, diagnostic reports, or operative details. This approach aims to reduce the time spent on each chart, What is the most appropriate course of action for the Health Information Management Department to address this feedback while maintaining coding integrity? Option A. Implement a mandatory comprehensive chart review process for all inpatient cases, ensuring coders consult all available documentation to assign the most specific ICD-10-CA and CCI codes, and provide additional training on the importance of detailed documentation review for accurate data capture. Option B. Adopt the proposed strategy of using the physician's initial assessment for the principal diagnosis and the most common CCI code for procedures to meet turnaround time targets, with a plan to audit for accuracy retrospectively. Option C. Allow coders to use their discretion to apply the proposed shortcut for cases where the physician's initial assessment appears straightforward, and only conduct a full chart review for highly complex or ambiguous cases. Option D. Communicate to stakeholders that turnaround times cannot be compromised and that the current coding process, while time-consuming, is necessary for accurate data without offering alternative solutions. The correct answer is A. Implement a mandatory comprehensive chart review process for all inpatient cases, ensuring coders consult all available documentation to assign the most specific ICD-10-CA and CCI codes, and provide additional training on the importance of detailed documentation review for accurate data capture. Explanation. Scenario analysis. This scenario is professionally challenging because it involves a direct conflict between the perceived efficiency of a shortcut and the absolute requirement for accurate and compliant coding. The pressure to reduce turnaround times, coupled with a misunderstanding of the nuances of ICD-10-CA and CCI, creates a fertile ground for errors that can have significant downstream consequences for patient care, billing, and health system analysis. The health information management professional must navigate this pressure while upholding their ethical and professional obligations. Correct approach analysis. The correct approach involves a commitment to thoroughness and adherence to official coding guidelines. This means meticulously reviewing the entire medical record, including physician documentation, diagnostic reports, and operative notes, to assign the most specific and accurate ICD-10-CA and CCI codes. This aligns with the principles of the Canadian Institute for Health Information, CHIMA, and the standards expected of CHIMA-certified professionals. Accurate coding is fundamental to reliable health data, which in turn supports evidence-based decision-making, appropriate reimbursement, and effective health system planning. Deviating from this rigorous process compromises data integrity and violates professional standards. Incorrect approach is analysis. One incorrect approach involves relying solely on the principal diagnosis as documented by the physician without further investigation. This fails to account for secondary diagnoses that may be equally or more significant for patient care and resource utilization, leading to incomplete or inaccurate coding. It also bypasses the HIM professional's responsibility to interpret and code based on the entirety of the record, not just a single entry. Another incorrect approach is to use a common or frequently coded code for a condition when the documentation suggests a more specific manifestation or complication. This shortcut, driven by perceived efficiency, ignores the specificity required by ICD-10-CA and CCI, leading to data that does not accurately reflect the patient's clinical picture. This can result in misrepresentation of disease prevalence, treatment patterns, and resource allocation. A third incorrect approach is to assign codes based on the patient's chief complaint alone, without consulting physician documentation or diagnostic results. The chief complaint is a starting point, but it is rarely sufficient for accurate diagnostic coding. This approach ignores the critical information provided by clinicians and diagnostic tests, leading to codes that are likely to be inaccurate and misleading. Professional reasoning. Professionals should approach coding challenges by prioritizing accuracy and compliance above all else. This involves a systematic review of the medical record, a deep understanding of ICD-10-CA and CCI coding principles and guidelines, and a commitment to seeking clarification from clinicians when documentation is unclear or incomplete. When faced with pressure to expedite coding, professionals must advocate for the importance of accurate data and explain the potential negative repercussions of shortcuts. This decision-making process is guided by the CHIMA Code of Ethics and Professional Practice Standards, which emphasize integrity, accuracy, and the responsible management of health information. Question 3. Process analysis reveals a consistent pattern of incomplete patient demographic information and occasional inaccuracies in diagnosis codes being entered into the electronic health record system by frontline clinical staff. This is impacting the accuracy of patient registries and the efficiency of billing processes. What is the most appropriate course of action for the Health Information Management Department to address this data quality issue? Option A. Prioritize the speed of data entry by allowing staff to bypass certain fields if they are unsure of the information, with the understanding that the data will be cleaned up by the HIM department at a later date. Option B. Focus solely on developing automated data validation rules within the EHR system to flag potential errors after data has been entered, without additional staff training or process review. Option C. Develop and implement a comprehensive data quality improvement plan that includes staff education on the importance of accurate and complete data, revised data entry protocols, and the establishment of a feedback mechanism for identifying and correcting errors. Option D. Implement a strict policy of disciplinary action for any staff member found to have entered incomplete or inaccurate data, with the goal of deterring future errors. The correct answer is C. Develop and implement a comprehensive data quality improvement plan that includes staff education on the importance of accurate and complete data, revised data entry protocols, and the establishment of a feedback mechanism for identifying and correcting errors. Explanation. This scenario presents a common challenge in health information management, balancing the immediate need for data with the imperative to maintain its integrity. The professional challenge lies in the potential for incomplete or inaccurate data to impact patient care, research, and administrative processes, while also acknowledging the operational pressures that can lead to data entry shortcuts. Careful judgment is required to implement solutions that are both effective in improving data quality and sustainable within the healthcare environment. The correct approach represents best professional practice because it directly addresses the root causes of data quality issues by involving frontline staff in the development and implementation of solutions. This aligns with CHIMA ethical principles and professional standards, which emphasize the importance of accurate, complete, and timely health information for patient safety and effective healthcare delivery. Specifically, it upholds the principle of data integrity by establishing clear processes for data validation and correction. Furthermore, it fosters a culture of data stewardship, where all staff understand their role in maintaining high-quality information. This proactive and collaborative strategy is more effective and sustainable than reactive measures. An incorrect approach that focuses solely on punitive measures for data entry errors fails to address the underlying systemic issues contributing to poor data quality. This can lead to staff resentment and a reluctance to report errors, ultimately hindering improvement efforts. It also violates ethical principles by not providing adequate support or training to staff, and it may not align with privacy legislation that requires data to be accurate and up-to-date. Another incorrect approach that relies on manual, post-hoc data cleansing without addressing the initial entry process is inefficient and prone to ongoing errors. While it may catch some issues, it does not prevent them from occurring in the first place, thus failing to meet the standard of timeliness and completeness. This approach also overlooks the importance of proactive data quality management, which is a cornerstone of effective health information management. A third incorrect approach that prioritizes speed of data entry over accuracy and completeness, even with the intention of later correction, directly compromises the integrity of the health record. This can have immediate negative consequences for patient care, as decisions may be based on flawed information. It also fails to meet the fundamental requirements of data quality as outlined in professional standards and regulatory guidelines, which mandate that data be both accurate and complete at the point of entry or as close to it as possible. The professional reasoning process for similar situations should involve a systematic approach. 1. Identify the specific data quality issues and their impact. 2. Investigate the root causes of these issues, involving the staff who generate and use the data. 3. Develop a multifaceted strategy that includes education, process improvements, and technological solutions. 4. Implement the strategy collaboratively with stakeholders. 5. Monitor the effectiveness of the implemented solutions and make adjustments as needed. 6. Foster a culture of continuous improvement in data quality management. Question 4. Investigation of a provincial health authority's initiative to improve data sharing between hospitals and community clinics reveals a critical need to standardize the exchange of patient medication histories. The authority is considering several approaches to achieve this. Which approach best aligns with Canadian health information management principles and regulatory expectations for interoperability? Option A. Developing a secure file transfer protocol, SFTP, solution to exchange raw data files containing medication information, with each receiving system responsible for parsing and interpreting the data based on its own internal logic. Option B. Implementing a custom-built data translation layer that maps proprietary medication data fields from each source system into a common, internally defined format, without explicit reference to established international standards. Option C. Prioritizing the adoption of HL7 v2X messaging for medication orders and updates, and concurrently implementing SNOMED-CT for medication concepts and LOINC for medication-related laboratory observations, ensuring proper mapping and validation. Option D. Relying on manual data entry of medication histories into a centralized database, assuming that clinical staff will ensure accuracy and completeness, and that this process is sufficient for data sharing. The correct answer is B. Implementing a custom-built data translation layer that maps proprietary medication data fields from each source system into a common, internally defined format, without explicit reference to established international standards. Explanation. This scenario presents a common challenge in health information management, ensuring seamless data exchange between disparate healthcare systems. The professional challenge lies in navigating the technical complexities of interoperability while adhering to the strict regulatory and ethical obligations governing health information in Canada. Specifically, the scenario requires a deep understanding of how to leverage established standards like HL7, SNOMED-CT, and LOINC to facilitate secure and accurate data sharing, which is paramount for patient safety, continuity of care, and research. The need for a decision-making framework arises from the potential for misinterpretation or misapplication of these standards, leading to data integrity issues, privacy breaches, or non-compliance with Canadian health legislation. The correct approach involves a systematic evaluation of the existing system's capabilities and limitations against the requirements for interoperability, prioritizing the adoption of standardized messaging formats, HL7, and clinical terminologies, SNOMED-CT for concepts, LOINC for observations. This aligns with the principles of data stewardship and the legal requirements for accurate and accessible health records under Canadian privacy legislation. By focusing on these established standards, the organization ensures that data is not only exchanged, but also understood and interpreted consistently across different platforms, thereby enhancing patient care and supporting health system objectives. This approach is best professional practice because it directly addresses the technical and regulatory imperatives for interoperability, promoting data quality, security, and compliance. An incorrect approach would be to assume that proprietary data formats can be easily integrated without explicit mapping to recognized standards. This fails to acknowledge the fundamental purpose of interoperability standards, which is to create a common language for health information. Such an approach risks data corruption, misinterpretation, and significant privacy breaches, as sensitive patient information may be transmitted in an insecure or unstandardized manner. This violates the ethical duty to protect patient confidentiality and the legal obligations to manage health information responsibly. Another incorrect approach would be to prioritize speed of implementation over adherence to standards, perhaps by using ad hoc data conversion methods. This bypasses the rigorous validation and testing inherent in implementing standardized solutions. The regulatory failure here lies in the potential for non-compliance with data exchange requirements mandated by provincial or federal health authorities, which often stipulate the use of specific standards. Ethically, it compromises the integrity of patient data, which can have serious consequences for clinical decision-making. A third incorrect approach might be to focus solely on HL7 messaging, without considering the semantic interoperability provided by SNOMED-CT and LOINC. While HL7 defines the structure of messages, SNOMED-CT and LOINC provide the standardized vocabulary for the content. Without these terminologies, the meaning of the data within the HL7 messages can be ambiguous, leading to misinterpretation and errors in patient care. This represents a failure to achieve true interoperability, as the data, though exchanged, may not be understood correctly, impacting both clinical outcomes and the ability to aggregate data for health system analysis. The professional decision-making process for similar situations should involve a thorough needs assessment, followed by a gap analysis between current capabilities and interoperability requirements. This should be followed by a structured evaluation of available standards and technologies, with a strong emphasis on compliance with Canadian health information management regulations and ethical best practices. A phased implementation approach, with robust testing and validation at each stage, is crucial. Collaboration with IT, clinical staff, and privacy officers is essential to ensure all aspects of interoperability, from technical implementation to data governance and patient privacy, are adequately addressed. Question 5. What factors determine the successful integration of a new health information system? From the perspective of various healthcare stakeholders within the Canadian healthcare landscape. Option A. The adoption of the most advanced technological features available in the market, regardless of immediate applicability. Option B. The lowest initial purchase price of the software and hardware components. Option C. The extent to which the can be customized to individual user preferences without regard for system-wide interoperability. Option D. Alignment of functionalities with clinical workflows, data integrity requirements, and patient privacy/security mandates. The correct answer is D. Alignment of functionalities with clinical workflows, data integrity requirements, and patient privacy/security mandates. Explanation. This scenario is professionally challenging because the implementation of a new health information system, directly impacts patient care, data integrity, and the efficiency of healthcare professionals. The decision-making process requires balancing technological capabilities with the practical needs and regulatory obligations of various stakeholders. Careful judgment is essential to ensure the supports, rather than hinders, the delivery of safe and effective healthcare, while adhering to Canadian privacy and security legislation. The correct approach represents best professional practice because it prioritizes the needs and perspectives of the end users and the organization's strategic goals, ensuring the is fit for purpose. This aligns with the CHIMA Code of Ethics and Professional Conduct, which emphasizes the importance of patient safety, data quality, and responsible information management. By involving all relevant stakeholders, including clinicians, administrators, and IT professionals, the organization can identify potential issues early, foster buy-in, and ensure the system meets the diverse requirements for patient care, reporting, and compliance with provincial and federal health information legislation. An incorrect approach that focuses solely on cost reduction without considering functionality or user needs would fail to meet the primary objective of which is to support patient care and operational efficiency. This could lead to a system that is difficult to use, generates inaccurate data, or fails to meet reporting requirements, potentially violating principles of data integrity and patient safety. Another incorrect approach that prioritizes the latest technological features without assessing their relevance to the organization's specific workflows and patient population would be a misallocation of resources and could introduce unnecessary complexity. This might lead to a system that is expensive to maintain and does not effectively address the core needs of healthcare providers, potentially impacting the quality of care and leading to non-compliance with data stewardship responsibilities. A third incorrect approach that neglects to consider the privacy and security implications of the would be a significant regulatory and ethical failure. In Canada, health information is protected by stringent privacy legislation at both the provincial and federal levels, e.g., PIPEDA, Provincial Health Information Acts. Failing to incorporate robust security measures and privacy safeguards from the outset could lead to data breaches, loss of patient trust, and severe legal and financial penalties. The professional decision-making process for similar situations should involve a comprehensive needs assessment, stakeholder engagement, thorough evaluation of system functionalities against organizational requirements and regulatory mandates, and a phased implementation with ongoing monitoring and evaluation. Professionals must act as stewards of health information, ensuring systems are implemented ethically, securely, and effectively to support patient care and organizational objectives. Question 6. When evaluating the accuracy of diagnostic codes assigned to a patient's record, a health information management professional reviews the physician's dictated operative report. The report briefly mentions a lesion in the abdomen, but does not specify its exact nature or location beyond the general area. The professional also notes that the physician's progress notes, which are more detailed, describe a suspicious mass in the right lower quadrant of the abdomen, with further investigation pending. Considering the principles of accurate clinical coding and the requirements of health information management in Ontario, which of the following actions best represents the professional's responsibility? Option A. Assign a code for a benign abdominal lesion, assuming the suspicious nature will likely resolve with further testing. Option B. Assign a code for a general abdominal lesion, as the operative report is the primary source for procedural coding. Option C. Assign a code for a suspicious mass in the right lower quadrant and query the physician for further clarification on the nature of the lesion. Option D. Assign a code for a general abdominal lesion, as this is the most direct information available in the operative report. The correct answer is D. Assign a code for a general abdominal lesion, as this is the most direct information available in the operative report. Explanation. This scenario presents a common challenge in clinical coding, ensuring accurate and compliant assignment of diagnostic and procedural codes based on physician documentation. The professional challenge lies in interpreting potentially ambiguous or incomplete documentation while adhering strictly to the official coding guidelines and the Personal Health Information Protection Act, FIPA in Ontario, Canada, which governs the collection, use, and disclosure of personal health information. Accurate coding is crucial for patient care continuity, billing, research, and public health reporting, and errors can have significant downstream consequences. The correct approach involves a systematic process of reviewing the complete medical record, identifying all documented diagnoses and procedures, and then applying the official coding guidelines, e.g., ICH-10CA and CCI, to assign the most specific and appropriate codes. This includes seeking clarification from the physician when documentation is unclear or insufficient, as mandated by best practices in health information management and implied by the need for accurate data under FIPA. This approach ensures data integrity, supports appropriate reimbursement, and facilitates accurate health system analysis, all while respecting patient privacy by only accessing and using the necessary health information. An incorrect approach that relies solely on the physician's summary without reviewing the full chart fails to capture all relevant clinical information, potentially leading to undercoding or miscoding. This violates the principle of accurate representation of patient care and can have financial and clinical implications. Another incorrect approach, that of assigning codes based on assumptions or prior knowledge of similar cases without consulting the current documentation, is a direct contravention of coding standards and can lead to significant data inaccuracies. This also poses an ethical risk by misrepresenting the patient's condition and treatment. Furthermore, an approach that involves disclosing unverified or incomplete coding information to external parties before finalization would violate FIPA provisions regarding the protection of personal health information and the requirement for accuracy and completeness of information. Professionals should employ a decision-making process that prioritizes thoroughness, accuracy, and compliance. This involves 1. Understanding the scope of the coding task and relevant documentation requirements. 2. Meticulously reviewing the entire medical record. 3. Applying official coding guidelines consistently. 4. Proactively seeking clarification from clinicians when necessary. And 5. Ensuring all coding activities align with privacy legislation like FIPA. Question 7. The risk matrix shows a potential unauthorized access alert to a patient's electronic health record by a user whose access level does not typically permit such viewing. The alert has been flagged as high priority. As a health information professional responsible for system oversight, what is the most appropriate immediate course of action? Option A. Delete the electronic health record associated with the alert to prevent further unauthorized access. Option B. Directly contact the patient to inform them of the potential unauthorized access and gather their input. Option C. Ignore the alert and assume it is a system error or false positive, as direct investigation is outside your immediate scope. Option D. Immediately notify the organization's privacy officer and the designated supervisory authority as per breach notification protocols. The correct answer is D. Immediately notify the organization's privacy officer and the designated supervisory authority as per breach notification protocols. Explanation. This scenario presents a professional challenge due to the inherent tension between the need for timely access to patient information for clinical decision-making and the imperative to protect patient privacy and comply with privacy legislation. Health information professionals, HIP, are entrusted with safeguarding sensitive health data, and their role extends beyond mere record-keeping to ensuring data integrity, security, and appropriate access. The risk matrix highlights a potential breach of privacy, which could have significant legal, ethical, and reputational consequences for the healthcare organization and the individuals involved. The correct approach emphasizes a systematic and compliant response to a potential privacy breach. It involves immediate notification to the designated privacy officer and the relevant supervisory authority as mandated by Canadian privacy legislation, such as PIPEDA, Personal Information Protection and Electronic Documents Act, or provincial equivalents like Alberta's PIPA or Quebec's Law 25, depending on the specific jurisdiction of the CHIMA certification. This approach aligns with the ethical obligations of HIPs to act with integrity and to uphold patient confidentiality. It also ensures that the organization can initiate its incident response plan, investigate the breach thoroughly, mitigate further harm, and fulfill its legal reporting requirements, thereby demonstrating due diligence and accountability. An incorrect approach that involves directly contacting the patient without involving the privacy officer or supervisory authority fails to adhere to established protocols for handling privacy breaches. This bypasses the organizational governance structure designed to manage such incidents, potentially leading to inconsistent communication, inadequate investigation, and a failure to meet legal reporting obligations. It also risks compromising the integrity of the investigation by allowing direct, unmanaged communication with the affected individual before the full scope of the breach is understood. Another incorrect approach, which is to ignore the alert and assume it is a false positive without proper investigation, is a severe dereliction of duty. This directly violates the principles of due diligence and the legal requirements to protect personal health information. It leaves the organization vulnerable to significant penalties, reputational damage, and a loss of patient trust. HIPs have a professional responsibility to investigate all potential security and privacy incidents, regardless of their perceived likelihood. A further incorrect approach, which is to delete the record associated with the alert without investigation or documentation, is equally problematic. This action destroys potential evidence, hinders any subsequent investigation into the nature of the alert, and prevents the organization from understanding the root cause of the issue. It is a reactive measure that does not address the underlying problem and could lead to repeated incidents. It also fails to meet the requirements for audit trails and record retention, mandated by health information management standards and legislation. Professional reasoning process for HIPs in such situations should involve a clear understanding of their organization's privacy policies and procedures, as well as relevant federal and provincial privacy legislation. Upon encountering a potential privacy breach, the immediate steps should be to 1. Assess the nature and severity of the potential breach. 2. Consult organizational policies and escalate to the designated privacy officer or security team. 3. Follow the established incident response plan, which typically includes investigation, containment, notification, and remediation. 4. Document all actions taken and decisions made. This structured approach ensures compliance, protects patient rights, and upholds the professional integrity of the health information management profession. Question 8. The efficiency study reveals a significant increase in the time taken for clinicians to access patient electronic health records, leading to concerns about potential impacts on patient care and staff frustration. As a health information management professional, which of the following approaches best addresses this situation while upholding regulatory and ethical obligations? Option A. Advise clinicians to simply be more patient and efficient in their record-seeking behavior, attributing the delays to individual user performance rather than systemic issues. Option B. Conduct a comprehensive risk assessment of the electronic health record system's access protocols, audit logs, and user authentication mechanisms to identify specific bottlenecks and vulnerabilities contributing to the delay. Option C. Propose a complete overhaul of the electronic health record system's infrastructure, without first investigating the current system's specific performance metrics or user workflows. Option D. Immediately implement a simplified, less restrictive access policy for all users to expedite record retrieval, assuming the primary issue is overly complex security measures. The correct answer is B. Conduct a comprehensive risk assessment of the electronic health record system's access protocols, audit logs, and user authentication mechanisms to identify specific bottlenecks and vulnerabilities contributing to the delay. Explanation: the efficiency study reveals a significant increase in the time taken to access patient records, impacting clinical workflow and potentially patient care. This scenario is professionally challenging because it directly links information management practices to patient safety and operational effectiveness. Health information professionals must balance the need for robust security and privacy with the imperative of timely access for authorized users. The challenge lies in identifying the root cause of the inefficiency without compromising the integrity or confidentiality of health information, all while adhering to Canadian health privacy legislation and CHIMA ethical standards. The correct approach involves a systematic risk assessment focused on identifying vulnerabilities in the information access process. This includes evaluating the current access controls, audit trails, system performance, and user training. By understanding the specific risks associated with slow access, such as potential for unauthorized access if workarounds are implemented, or delays in critical care decisions, the health information professional can develop targeted mitigation strategies. This aligns with the principles of privacy by design and security by default, as mandated by provincial and federal privacy laws, e.g., PIPTA, Provincial Health Information Acts, and CHIMA Code of Ethics, which emphasize protecting patient information while ensuring its availability for legitimate purposes. An incorrect approach would be to immediately implement a broad, less secure access method to speed up retrieval. This fails to acknowledge the inherent risks of unauthorized disclosure or modification of sensitive health information, violating the duty of care and the principles of confidentiality and security enshrined in Canadian health privacy legislation. Another incorrect approach is to simply blame user error without investigating system or process deficiencies. This neglects the responsibility of the Health Information Department to ensure systems and workflows are optimized and that users are adequately supported, potentially leading to continued inefficiencies and increased risk of errors. Focusing solely on system upgrades without considering the impact on existing workflows or user training also represents a failure to conduct a comprehensive risk assessment, as it overlooks the human and process elements critical to effective information management. Professionals should employ a decision-making framework that begins with clearly defining the problem and its potential impact. This is followed by identifying all relevant stakeholders and their perspectives. A thorough risk assessment, considering both the likelihood and impact of identified risks, is then conducted. Mitigation strategies are developed, prioritizing those that offer the best balance of security, privacy, efficiency, and compliance. Finally, solutions are implemented with ongoing monitoring and evaluation to ensure effectiveness and adapt to changing circumstances. Question 9. The assessment process reveals that a new Provincial Health Information Exchange (HI) platform is being implemented to improve care coordination across various healthcare facilities. During the implementation phase, a debate arises among stakeholders regarding the primary mechanism for authorizing patient data access through the HIE. One group advocates for a system that relies on the healthcare provider's professional judgment and the existing doctor-patient relationship to grant access, arguing it streamlines clinical workflows. Another group insists on a robust, explicit patient consent model for all data shared via the HIE, even for direct care purposes. A third perspective suggests that consent should be managed at the point of care by individual providers, with the HIE acting as a passive conduit. Considering the regulatory framework governing health information management in Canada, which approach best aligns with the principles of patient privacy and lawful data exchange. Option A. Relying on the professional judgment of healthcare providers to determine when access to patient information through the HIE is clinically necessary, assuming implied consent based on the provision of care. Option B. Implementing a system that requires explicit, informed patient consent for all data to be shared through the HIE, with clear information provided to patients about who will access their data and for what purposes. Option C. Designing the HIE to function as a passive conduit, where consent management is entirely delegated to individual healthcare providers at the point of care, without a centralized HIE-level consent mechanism. Option D. Prioritizing the technical ability of the HIE to facilitate immediate data access for all authorized healthcare providers, with a post hoc review process for any privacy concerns. Correct answer is B. Implementing a system that requires explicit, informed patient consent for all data to be shared through the HIE, with clear information provided to patients about who will access their data and for what purposes. Explanation. The assessment process reveals a common challenge in health information exchange: high implementation, balancing the need for efficient data sharing with the paramount importance of patient privacy and consent, all within the strict confines of Canadian health privacy legislation. This scenario is professionally challenging because it requires a nuanced understanding of how HIE systems interact with existing privacy frameworks, particularly the Personal Information Protection and Electronic Documents Act, PIPEDA, and relevant provincial health information legislation, e.g., Ontario's Personal Health Information Protection Act, FIPA. The core tension lies in ensuring that data shared through HIE is done so with appropriate authorization and for legitimate purposes, while also enabling the timely access necessary for quality patient care. Professionals must navigate these complexities without compromising patient trust or legal compliance. The correct approach represents best professional practice because it prioritizes obtaining explicit, informed consent from patients for the sharing of their health information through the HIE, while also ensuring that the HIE's governance framework clearly defines the purposes for which data can be accessed and by whom. This aligns with the principles of consent and purpose limitation enshrined in Canadian privacy law. It acknowledges that while HIE facilitates data flow, the underlying right to privacy and control over personal health information remains with the individual. Furthermore, robust governance ensures accountability and transparency in data handling, which are critical for maintaining public confidence in HIE initiatives. An incorrect approach that focuses solely on the technical capabilities of the HIE to transmit data without addressing patient consent or clear governance fails to meet regulatory requirements. This would constitute a breach of privacy principles, as it bypasses the individual's right to control their personal health information. Another incorrect approach that assumes implied consent based on the provision of healthcare services for data exchange would also be problematic. Canadian privacy law generally requires explicit consent for the collection, use, and disclosure of sensitive personal health information, especially when it moves beyond the immediate circle of care and into a broader HIE. Relying on implied consent in such a context risks contravening the purpose limitation principle and the requirement for lawful basis for data processing. Finally, an approach that prioritizes provider access over patient consent, even if for perceived clinical benefit, is ethically and legally unsound, as it undermines the fundamental right to privacy. The professional decision-making process for similar situations should involve a thorough review of applicable federal and provincial health privacy legislation. This includes understanding the definitions of personal health information, the requirements for consent, explicit vs. implied, and the permissible uses and disclosures. Professionals must then assess the specific HIE's design and governance structure against these legal requirements. They should engage with legal counsel and privacy officers to ensure compliance. A risk assessment should be conducted to identify potential privacy breaches and develop mitigation strategies. Ultimately, the decision-making process must be guided by the principles of privacy by design and privacy by default, ensuring that patient privacy is embedded into the HIE system from its inception, and that the default settings protect individual rights. Question 10. Process analysis reveals that a research team has requested access to de-identified patient data from the Electronic Health Record (EHR) system to study trends in a specific chronic disease. The research team states that they will remove direct identifiers, but the HIM department has concerns about the potential for re-identification given the granularity of the data. The HIM professional is tasked with determining the appropriate course of action to ensure compliance with Canadian Health Information Management regulations and ethical standards. Option A. Deny the request outright, as any use of EHR data for research requires explicit patient consent for each individual record. Option B. Facilitate the provision of the data only after a robust de-identification process, validated by the HIM department or a designated privacy officer, has been completed ensuring that the risk of re-identification is minimized to an acceptable level according to privacy legislation. Option C. Provide the research team with access to the full, identifiable EHR data, trusting their assurance that they will handle it responsibly and only use it for the stated research purpose. Option D. Proceed with providing the data after the research team removes direct identifiers, assuming their process is sufficient for de-identification. Correct answer is D. Proceed with providing the data after the research team removes direct identifiers, assuming their process is sufficient for de-identification. Explanation. Scenario analysis. This scenario presents a common ethical dilemma in health information management, HIM, concerning the balance between patient privacy and the need for research. The challenge lies in navigating the strict privacy provisions of Canadian health legislation, such as PIPEDA, Personal Information Protection and Electronic Documents Act, and provincial health privacy laws, while also recognizing the potential societal benefit of de-identified health data for research. The HIM professional must act as a steward of patient information, upholding legal and ethical obligations. Correct approach analysis. The correct approach prioritizes obtaining explicit consent or ensuring robust de-identification of the health record data according to established privacy principles and legal requirements before it can be used for research. This aligns with the core principles of health privacy legislation in Canada, which emphasize consent and the protection of personal health information. De-identification, when performed rigorously and in accordance with guidelines, minimizes the risk of re-identification and respects the individual's right to privacy while still allowing for valuable research. This approach demonstrates a commitment to both patient rights and the advancement of health knowledge. Incorrect approach is analysis. Using the electronic health record, EHR, data without explicit patient consent or a formal de-identification process, even for research purposes, directly violates the principles of informed consent and privacy protection enshrined in Canadian health privacy laws. This constitutes a serious breach of trust and legal obligation. Sharing identifiable patient information with researchers under the guise of anonymity, without a formal, validated de-identification process, is a critical failure. True anonymity requires more than just removing names. It involves ensuring that the data cannot be linked back to an individual through other means, a standard that is legally defined and technically challenging to achieve without proper methodology. Assuming that research inherently justifies the use of identifiable data without proper authorization or safeguards is a misinterpretation of ethical and legal responsibilities. While research is valuable, it must be conducted within a framework that respects individual privacy rights. Professional reasoning. Professionals in HIM must adopt a decision-making process that begins with identifying the relevant legal and ethical frameworks. In Canada, this involves understanding federal and provincial health privacy legislation, as well as professional codes of ethics. When faced with a request for patient data, the HIM professional should first determine if the request falls under any exceptions to consent, e.g., specific legal requirements for disclosure. If not, the primary considerations are obtaining informed consent or ensuring that the data is de-identified to a standard that meets legal and ethical requirements. This involves consulting with legal counsel or privacy officers when necessary and adhering to established institutional policies and procedures for data access and research. Question 11. The risk matrix shows a moderate risk associated with the current workflow for processing patient information. Considering the distinct characteristics and regulatory requirements of clinical, administrative, and financial health data, which approach best optimizes the process while upholding data integrity and privacy? Option A. Prioritize the optimization of financial data processing workflows to improve billing efficiency, with the understanding that clinical data will be addressed in a separate, subsequent initiative. Option B. Implement a phased approach to data governance, starting with a comprehensive classification of clinical, administrative, and financial data, followed by the development of tailored data validation rules, security protocols, and access controls for each category, and then optimizing workflows based on these established standards. Option C. Consolidate all incoming patient data into a single, centralized database with minimal access restrictions to facilitate faster retrieval and analysis across all data types. Option D. Streamline the data entry process for all patient information by reducing the number of validation checks to increase throughput, assuming that subsequent data cleansing efforts will rectify any inaccuracies. The correct answer is B. Implement a phased approach to data governance, starting with a comprehensive classification of clinical, administrative, and financial data, followed by the development of tailored data validation rules, security protocols, and access controls for each category, and then optimizing workflows based on these established standards. Explanation. This scenario presents a common challenge in health information management, balancing the need for process optimization with the imperative to maintain data integrity and comply with privacy regulations. The risk matrix highlights potential vulnerabilities in how different types of health data are managed. The core professional challenge lies in identifying and implementing improvements that enhance efficiency without compromising the accuracy, security, or confidentiality of clinical, administrative, and financial health data, all within the strict confines of Canadian health information management legislation and CHIMA ethical standards. The correct approach focuses on a systematic review and enhancement of data governance policies and procedures. This aligns with best professional practice by ensuring that any process optimization is grounded in a thorough understanding of data types, their life cycle, and associated risks. Specifically, it emphasizes the need to differentiate between clinical, administrative, and financial data, recognizing their unique characteristics and regulatory requirements under Canadian privacy laws, e.g., PIPTA, Provincial Health Information Acts, by prioritizing data classification, security protocols, and access controls tailored to each data type. This approach upholds the principles of data stewardship, accuracy, and confidentiality, which are fundamental to CHIMA certification. An incorrect approach that prioritizes solely on the speed of data entry without considering data validation and accuracy introduces significant risks. This fails to meet the regulatory requirement for accurate health records and can lead to misdiagnosis, inappropriate treatment, and financial errors. Ethically, it breaches the duty of care owed to patients. Another incorrect approach that involves consolidating all health data into a single, undifferentiated repository without robust security measures or access controls is a direct violation of privacy legislation. This creates a high-risk environment for data breaches and unauthorized access, failing to protect sensitive clinical, administrative, and financial information. It disregards the principle of least privilege and data minimization. A further incorrect approach that focuses on optimizing financial data processes at the expense of clinical data integrity overlooks the interconnectedness of these data types and the potential downstream impacts. Clinical data accuracy is paramount for patient care, and any process that jeopardizes it, even in pursuit of financial efficiency, is professionally unacceptable and ethically unsound. The professional reasoning process for similar situations should involve a comprehensive risk assessment, followed by a data governance strategy that clearly defines data types, their purposes, and their life cycle. This strategy must incorporate robust security measures, access controls, and audit trails, all aligned with Canadian health privacy legislation and CHIMA ethical guidelines. Decision-making should prioritize patient safety, data integrity, and regulatory compliance, with process optimization serving as a means to achieve these ends, not an end in itself. Question 12. Benchmark analysis indicates that a provincial health authority is seeking to leverage its extensive electronic health record, (EHR), data to identify patterns in chronic disease management across different patient demographics. The goal is to inform targeted public health interventions. However, the authority is concerned about the privacy implications of using this sensitive data. Which of the following approaches best balances the need for robust health analytics with the stringent privacy requirements governing health information in Canada? Option A. Implement advanced de-identification techniques to remove direct and indirect identifiers from the EHR data, ensuring that the resulting dataset is sufficiently anonymized for analytical purposes, and conduct a re-identification risk assessment before sharing the data for analysis. Option B. Proceed with direct analysis of identifiable patient data, relying on internal access controls and strict confidentiality agreements to protect patient privacy, as the analytical insights are critical for public health. Option C. Aggregate data at a very high level, e.g., by entire health region, and remove all demographic information to ensure absolute anonymity, even if this significantly limits the granularity and actionability of the analytical findings. Option D. Obtain explicit, informed consent from every individual patient whose data will be used for the chronic disease management analysis, acknowledging the significant administrative burden and potential for low response rates. The correct answer is A. Implement advanced de-identification techniques to remove direct and indirect identifiers from the EHR data, ensuring that the resulting dataset is sufficiently anonymized for analytical purposes, and conduct a re-identification risk assessment before sharing the data for analysis. Explanation: scenario analysis. This scenario is professionally challenging because it requires balancing the need for timely, actionable insights from health data with the stringent privacy and security obligations mandated by Canadian health information legislation, such as Provincial Personal Health Information Protection, Answ, FIPA, and federal PIPTA, where applicable. The risk of unauthorized disclosure or re-identification of sensitive patient data is significant, necessitating a robust understanding of data de-identification techniques and ethical considerations. Correct approach analysis. The correct approach represents best professional practice because it prioritizes patient privacy and data security while still enabling valuable health analytics. By employing de-identification techniques that render individuals unidentifiable, the organization adheres to the principles of data minimization and purpose limitation, which are core tenets of Canadian privacy law. This approach allows for the aggregation and analysis of health trends and outcomes without compromising the confidentiality of individual health records, thereby fulfilling both the analytical objectives and legal/ethical responsibilities. This aligns with the CHIMA Code of Ethics and Professional Standards that emphasize responsible stewardship of health information. Incorrect approaches analysis. An approach that involves directly using identifiable patient data for broad analytical purposes without explicit consent or robust de-identification is ethically and legally unacceptable. This violates the principles of privacy and confidentiality enshrined in Canadian health legislation, leading to potential breaches of trust, regulatory penalties, and reputational damage. Such an approach fails to uphold the duty of care owed to patients regarding their personal health information. An approach that focuses solely on technical de-identification, without considering the potential for re-identification through linkage with other datasets or contextual information, is also problematic. While technically de-identified, the data might still pose a privacy risk if not assessed for its re-identifiability potential, which is a key consideration under privacy frameworks. This could lead to inadvertent disclosures and a failure to meet the highest standards of data protection. An approach that delays or obstructs the analytics process due to an overly cautious or incomplete understanding of de-identification capabilities, thereby hindering the generation of crucial health insights, is professionally suboptimal. While caution is warranted, an inability to leverage de-identified data for legitimate analytical purposes can impede quality improvement initiatives, research, and public health reporting, which are vital functions of the healthcare system. This approach may not fully align with the organization's mandate to improve patient care through data-driven decision-making. Professional reasoning. Professionals in health information management must adopt a risk-based approach. This involves understanding the specific analytical objectives, the sensitivity of the data involved, and the applicable legal and ethical frameworks. When dealing with health data for analytics, the primary decision-making process should involve 1. Identifying the purpose of the analysis and the data required. 2. Assessing the privacy risks associated with the data. 3. Determining the most appropriate de-identification or anonymization strategy that balances analytical utility with privacy protection. 4. Implementing robust security measures for data handling and storage. 5. Seeking legal and ethical review when necessary, particularly for novel or complex analytical projects. This systematic approach ensures compliance, protects patient privacy, and maximizes the value derived from health information. Question 13. Cost-benefit analysis shows that implementing a new electronic health record (EHR) system presents an opportunity to enhance data quality and accessibility. Given the organization's limited budget and the need to integrate patient information seamlessly, which data collection method and source strategy would best align with CHIMA certification principles and Canadian health privacy legislation for the new EHR? Option A. Develop a separate, proprietary database for all new patient data, which will be periodically reconciled with the EHR. Option B. Focus on manual data abstraction from legacy paper records to populate the new EHR, ensuring comprehensive historical data capture. Option C. Implement a broad data collection strategy across all possible patient touchpoints, aiming to capture maximum data for future analytical potential. Option D. Prioritize leveraging structured data fields already integrated within the new EHR system, supplemented by targeted data validation processes. The correct answer is D. Prioritize leveraging structured data fields already integrated within the new EHR system, supplemented by targeted data validation processes. Explanation: scenario analysis. This scenario presents a common challenge in health information management, balancing the need for comprehensive data with the practicalities of data collection and resource allocation. The introduction of a new electronic health record (EHR) system necessitates a review of existing data collection methods. The challenge lies in identifying the most effective and compliant ways to gather the required information, considering both the benefits of richer data and the costs, financial, time, and human resources, associated with different methods. Ensuring data quality, accuracy, and adherence to privacy regulations like PIPEDA, Personal Information Protection and Electronic Documents Act, and provincial health privacy legislation is paramount. Correct approach analysis. The correct approach prioritizes leveraging existing, integrated data within the new EHR system. This aligns with the principles of data stewardship and efficient information management. By utilizing the structured data fields already present in the EHR, the organization minimizes the need for duplicate data entry or the development of entirely new collection tools. This method is generally more cost-effective, reduces the risk of transcription errors, and ensures data consistency. Furthermore, it supports the goal of a unified patient record, which is a cornerstone of effective health information management and facilitates better clinical decision-making and research. This approach is compliant with privacy legislation by minimizing the collection of unnecessary data and ensuring that data is collected at the source within a secure system. Incorrect approach is analysis. One incorrect approach involves relying heavily on manual data abstraction from paper-based records for the new system. This is inefficient, time-consuming, and prone to significant data entry errors, compromising data integrity. It also fails to capitalize on the capabilities of the new EHR, representing a missed opportunity for modernization and efficiency. Ethically and regulatorily, this method increases the risk of unauthorized access to sensitive information during the abstraction process, and may not meet the standards for data accuracy and completeness expected under health information management, best practices, and relevant legislation. Another incorrect approach is to implement a separate, standalone database for the new data, disconnected from the EHR. This creates data silos, leading to fragmented patient information and hindering comprehensive analysis. It increases the burden on staff to manage multiple systems and introduces complexities in data reconciliation and reporting. From a regulatory standpoint, maintaining separate, unintegrated data sources can complicate compliance with data security and privacy requirements, as it increases the attack surface and the potential for data breaches. It also undermines the principle of a single, authoritative source of truth for patient information. A further incorrect approach is to adopt a collect everything mentality without a clear purpose or data governance framework. This leads to the accumulation of vast amounts of potentially irrelevant or redundant data, increasing storage costs and making it difficult to extract meaningful insights. It also raises privacy concerns, as more data collected means a greater risk of exposure and potential misuse, even if collected with good intentions. This approach is not aligned with the principles of data minimization and purpose limitation, which are fundamental to privacy legislation. Professional reasoning. Professionals should approach data collection method selection by first clearly defining the information needs and the intended use of the data. This should be followed by an assessment of existing data sources and systems, including the capabilities of the new EHR. A thorough cost-benefit analysis, considering not only financial costs, but also time, resources, and data quality implications, is essential. Prioritizing integrated, structured data within the EHR, where possible, is generally the most efficient and compliant strategy. When new data collection is necessary, methods should be chosen that minimize redundancy, ensure data accuracy, and adhere strictly to privacy and security regulations. A robust data governance framework should guide all data collection and management activities. Question 14. The assessment process reveals that the chief of surgery has requested direct access to a dataset containing identifiable patient information to conduct an urgent audit of surgical outcomes. The chief of surgery states that the audit is time-sensitive and requires immediate access to the raw data, bypassing the usual data access request protocol, which involves a formal review by the Data Governance Committee. As a health information management professional responsible for data stewardship, how should you respond to this request? Option A. Grant the chief of surgery direct access to the identifiable patient data, as the urgency of the audit justifies bypassing standard procedures. Option B. Explain that direct access to identifiable patient data requires a formal data access request and approval through the established governance process, and guide the chief of surgery on how to submit this request. Option C. Advise the chief of surgery to contact the IT department directly to extract the necessary data, as they manage the technical infrastructure. Option D. Offer to anonymize the data for the chief of surgery without further consultation, as this will protect patient privacy. The correct answer is B. Explain that direct access to identifiable patient data requires a formal data access request and approval through the established governance process, and guide the chief of surgery on how to submit this request. Explanation. Scenario analysis. This scenario is professionally challenging because it involves a direct conflict between a department's operational needs and the established data governance policies designed to protect patient privacy and data integrity. The chief of surgery's request, while seemingly for a legitimate clinical purpose, bypasses established protocols for data access and use. Health information management professionals must navigate this tension by upholding their fiduciary duty to protect patient data while also supporting legitimate clinical and research endeavors. The challenge lies in balancing these competing interests without compromising regulatory compliance or patient trust. Correct approach analysis. The correct approach involves a health information management professional acting as a data steward, adhering strictly to the principles of data governance. This means recognizing the chief of surgery's request, but immediately referencing the established data governance framework and policies. The professional must explain that direct access to identifiable patient data for research or operational analysis requires formal approval through the established data access request process, which typically involves review by a research ethics board or a data governance committee. This process ensures that data use is authorized, ethically sound, and compliant with privacy legislation such as PIPEDA, Personal Information Protection and Electronic Documents Act, and relevant provincial health information legislation. By directing the request through the proper channels, the professional upholds their responsibility as a data steward, ensuring data is accessed and used appropriately, thereby protecting patient privacy and maintaining the integrity of health information. This aligns with the CHIMA Code of Ethics and Professional Conduct, which emphasizes accountability, confidentiality, and responsible stewardship of health information. Incorrect approach is analysis. Granting direct access to identifiable patient data without following the established data access request process is a significant regulatory and ethical failure. It violates the principles of data governance by circumventing established controls designed to prevent unauthorized access and use. This action would contravene privacy legislation, potentially leading to breaches of confidentiality and patient harm. It also undermines the authority of the data governance framework and the role of the health information management professional as a data steward. Suggesting the chief of surgery obtain the data directly from the IT department without involving him or the data governance committee is also problematic. While IT manages the systems, HIM is responsible for the governance and stewardship of the health information itself. This approach abdicates the HIM professional's responsibility and could lead to data being accessed or used in a manner that is not compliant with privacy laws or organizational policies, even if IT has the technical capability to extract it. Proposing to anonymize the data without understanding the specific research or operational purpose, and without following a defined de-identification protocol, is also a failure. While anonymization can protect privacy, it must be done correctly and in accordance with established standards. Improper anonymization can still lead to re-identification, and the decision to anonymize should be part of the formal data access request process, not a unilateral decision by the HIM professional. This approach bypasses the necessary oversight and validation steps. Professional reasoning. Professionals in health information management should approach such requests by first understanding the underlying need. They must then consult and strictly adhere to their organization's data governance policies and relevant privacy legislation. The decision-making process should involve 1. Identifying the request and its purpose. 2. Reviewing organizational policies and procedures for data access and use. 3. Consulting relevant privacy legislation, e.g., PIPEDA Provincial Health Acts. 4. Communicating clearly with the requester about the established process. 5. Facilitating the request through the appropriate governance channels, e.g., Data Governance Committee, Research Ethics Board. 6. Ensuring all data handling, access, and use are documented and compliant. This systematic approach ensures accountability, protects patient privacy, and upholds the integrity of health information. Question 15. The monitoring system demonstrates an unusual pattern of access to patient electronic health records by an administrative staff member outside of their typical working hours and without a clear documented purpose. The health information management professional responsible for system oversight notices this anomaly. Option A. Casually mention the suspicious activity to a few trusted colleagues to get their opinion on what might be happening. Option B. Ignore the monitoring system alert, assuming it is a minor system glitch or an insignificant event that does not warrant further attention. Option C. Initiate a formal investigation into the access logs, consult with the organization's privacy officer to determine the appropriate course of action, and follow established incident response protocols for potential privacy breaches. Option D. Immediately delete the suspicious access logs to prevent any potential misuse of the information and to maintain system cleanliness. Correct answer is C. Initiate a formal investigation into the access logs, consult with the organization's privacy officer to determine the appropriate course of action, and follow established incident response protocols for potential privacy breaches. Explanation. This scenario presents a professional challenge because it involves a potential breach of privacy legislation, specifically the Personal Health Information Protection Act, FIPA, in Ontario, and the Personal Information Protection and Electronic Documents Act, PIPEDA, at the federal level, which govern the collection, use, and disclosure of personal health information. The health information management professional must balance the need for system security and integrity with the fundamental right to privacy of individuals whose information is being accessed. The monitoring system's logs indicate activity that could be unauthorized, requiring a careful and systematic investigation to determine the nature and extent of any privacy violation. The correct approach represents best professional practice because it prioritizes a thorough, documented, and legally compliant investigation. By initiating a formal review of the system logs, consulting with the organization's privacy officer, and adhering to established incident response protocols, the professional ensures that any potential breach is handled in accordance with FIPA and PIPEDA. This includes identifying the individuals affected, assessing the risk of harm, and taking appropriate steps to mitigate that harm, which may involve notification and remediation. This systematic process upholds ethical obligations and legal requirements for protecting personal health information. An incorrect approach that involves immediately deleting the logs without proper investigation would be a significant regulatory and ethical failure. This action would obstruct a proper investigation, potentially conceal a breach, and violate the record-keeping requirements under both FIPA and PIPEDA, which mandate that organizations maintain records of access and disclosure of personal health information. Another incorrect approach, such as casually discussing the suspicious activity with colleagues without a formal process, would also be a failure. This informal dissemination of potentially sensitive information could lead to gossip, speculation, and further privacy breaches, undermining the confidentiality expected of health information professionals and violating the principles of data stewardship. Finally, ignoring the monitoring system alerts altogether would be a direct contravention of the organization's duty to protect personal health information and a failure to comply with the proactive security and privacy obligations mandated by FIPA and PIPEDA. The professional decision-making process for similar situations should involve a clear understanding of the relevant privacy legislation, FIPA and PIPEDA, established organizational policies and procedures for privacy breaches and incident response, and a commitment to ethical conduct. When suspicious activity is detected, the professional should 1. Document the observation meticulously. 2. Immediately report the observation through the designated channels, typically to a supervisor or the privacy officer. 3. Follow the organization's incident response plan, which will guide the investigation, risk assessment, and remediation steps. 4. Ensure all actions taken are in strict compliance with privacy laws and ethical guidelines, prioritizing the protection of individual privacy and the integrity of health information. Question 16. Strategic planning requires a healthcare organization to evaluate potential health information systems, HIS. Which of the following approaches best aligns with Canadian health information management principles and regulatory frameworks for selecting a new HIS? Option A. Conduct a comprehensive assessment of HIS options, rigorously evaluating each against current and future Canadian privacy legislation, e.g., PIPEDA, relevant provincial acts, security standards, organizational risk tolerance, and the ability to support robust data governance and patient confidentiality. Option B. Rely primarily on the vendor's claims of compliance with privacy and security regulations, without independent verification or detailed review of their data handling practices. Option C. Select the HIS that offers the most advanced technological features and functionalities, with a focus on immediate operational efficiency gains. Option D. Prioritize the HIS with the lowest upfront cost and ongoing maintenance fees, assuming all vendors adhere to general data protection standards. The correct answer is D. Prioritize the HIS with the lowest upfront cost and ongoing maintenance fees, assuming all vendors adhere to general data protection standards. Explanation. This scenario presents a professional challenge due to the critical need to balance technological advancement with the stringent privacy and security obligations mandated by Canadian health legislation, specifically the Personal Information Protection and Electronic Documents Act, PIPEDA, and relevant provincial health information privacy legislation, e.g., Ontario's Personal Health Information Protection Act, FIPA. The organization is considering a significant investment in a new health information system, HIS, that promises enhanced functionality, but also introduces new data handling complexities and potential vulnerabilities. The challenge lies in selecting an approach that not only meets the organization's operational and strategic goals, but also demonstrably upholds patient privacy, data integrity, and security, thereby ensuring compliance with legal and ethical standards. The correct approach, which involves a comprehensive assessment of HIS options against current and future privacy and security legislation, best professional practice, and organizational risk tolerance, represents the gold standard. This method ensures that any chosen HIS solution is evaluated not just for its technical capabilities, but also for its inherent compliance with privacy by design principles and its ability to support robust data governance. This aligns directly with the ethical obligations of health information management professionals to protect patient confidentiality and the legal requirements to safeguard personal health information. It demonstrates a proactive and responsible approach to technology adoption, prioritizing patient trust and regulatory adherence. Incorrect approaches fail to adequately address the multifaceted nature of HIS selection in a regulated healthcare environment. An approach that solely prioritizes cost reduction without a thorough privacy and security review risks implementing a system that is non-compliant, leading to potential data breaches, significant fines, and reputational damage. This violates the core principles of PIPEDA and provincial privacy laws, which mandate that organizations take all reasonable steps to protect personal information. An approach that focuses exclusively on the latest technological features, neglecting the legal and ethical implications of data handling, also poses a significant risk. It may overlook critical security vulnerabilities or data management capabilities necessary for compliance, thus exposing the organization to legal liabilities and ethical breaches. Furthermore, an approach that relies on vendor assurances without independent verification of compliance with Canadian privacy laws is negligent. Vendors may not fully understand or adhere to the specific nuances of Canadian health privacy legislation, and the ultimate responsibility for compliance rests with the healthcare organization. This failure to conduct due diligence constitutes a significant regulatory and ethical lapse. The professional decision-making process for similar situations should involve a structured risk assessment framework. This includes identifying all relevant legal and regulatory requirements, evaluating potential HIS solutions against these requirements, conducting thorough due diligence on vendor security and privacy practices, and establishing clear data governance policies and procedures for the new system. Professionals must engage legal counsel and privacy officers early in the process and ensure that all stakeholders understand their roles and responsibilities in maintaining data privacy and security. Continuous monitoring and auditing of the HIS post-implementation are also crucial to ensure ongoing compliance and to adapt to evolving threats and regulations. Question 17. Benchmark analysis indicates that a healthcare organization is planning to implement a new cloud-based electronic health record (EHR) system to ensure compliance with Canadian health information management regulations and best practices for data security. Which of the following approaches is most critical to undertake before the system is fully operational? Option A. Implement the system immediately and conduct a post-implementation review of security measures after a 6-month operational period. Option B. Focus exclusively on the technical security features of the EHR, overlooking administrative and physical safeguards. Option C. Rely solely on the cloud vendor's existing security certifications without independent verification. Option D. Conduct a comprehensive privacy impact assessment (PIA) and security risk assessment (SRA) to identify and mitigate potential risks. The correct answer is D. Conduct a comprehensive privacy impact assessment (PIA) and security risk assessment (SRA) to identify and mitigate potential risks. Explanation: Scenario analysis. This scenario presents a common challenge in health information management, balancing the need for robust security with the operational realities of implementing new technologies. The introduction of a cloud-based electronic health record (EHR) system necessitates a thorough impact assessment to identify potential security risks and ensure compliance with Canadian privacy legislation, specifically the Personal Information Protection and Electronic Documents Act (PIPEDA) and relevant provincial health privacy laws. The challenge lies in proactively identifying vulnerabilities before they can be exploited, which requires a systematic and comprehensive approach. Correct approach analysis. The correct approach involves conducting a comprehensive privacy impact assessment (PIA) and security risk assessment (SRA) prior to the full implementation of the cloud-based EHR. This aligns directly with best practices in health information management and regulatory requirements in Canada. A PIA, as mandated or strongly recommended by PIPEDA and provincial equivalents, systematically analyzes how personal health information will be collected, used, disclosed, and retained, identifying potential privacy risks and outlining mitigation strategies. An SRA complements this by specifically evaluating the technical, administrative, and physical safeguards in place to protect the confidentiality, integrity, and availability of health information. By integrating these assessments, the organization can proactively address security vulnerabilities, ensure compliance with legal obligations regarding data protection, and build trust with patients and stakeholders. This approach demonstrates due diligence and a commitment to safeguarding sensitive health data, which is a core ethical and legal responsibility for HIM professionals. Incorrect approaches analysis. Implementing the system first and then conducting a post-implementation review of security measures is a significant regulatory and ethical failure. This reactive approach violates the principles of proactive risk management and data protection embedded in Canadian privacy laws. It means that sensitive health information could be exposed to risks during the operational period without adequate safeguards, leading to potential breaches and contraventions of PIPEDA and provincial legislation. Relying solely on the vendor's security certifications without independent verification is also problematic. While vendor certifications are a good starting point, they do not absolve the healthcare organization of its responsibility to ensure that the chosen system and its implementation meet the specific security and privacy requirements of the Canadian healthcare context and its own policies. This could lead to non-compliance if the vendor's certifications do not cover all relevant aspects or if the implementation introduces new vulnerabilities. Focusing only on the technical security aspects of the EHR and neglecting the administrative and physical safeguards is another failure. Security is multifaceted. Administrative safeguards include policies, procedures, and training, while physical safeguards involve securing the physical environment where data is accessed or stored. A holistic approach is required by Canadian privacy laws to ensure comprehensive protection of personal health information. Professional reasoning. When faced with the implementation of new health information systems, HIM professionals must adopt a proactive and risk-based approach. The decision-making process should prioritize a thorough understanding of the regulatory landscape, including PIPTA and relevant provincial health privacy legislation. This involves initiating comprehensive impact assessments, PIA and SRA, early in the project lifecycle. Professionals should engage with IT, legal, and operational stakeholders to identify potential risks and develop robust mitigation strategies. The principle of privacy by design and security by design should guide all decisions. Regular review and updates of security policies and procedures, along with ongoing staff training, are crucial for maintaining a secure information environment. When evaluating third-party vendors, due diligence is paramount, including verifying their security practices and ensuring contractual agreements clearly define responsibilities for data protection. Question 18. Operational review demonstrates that a physician requests immediate access to a patient's complete medical record, stating it is critical for an ongoing emergency medical intervention. The physician is not the patient's primary care provider and has not previously accessed this patient's record. The HIM department is experiencing a high volume of requests. What is the most appropriate course of action for the HIM professional to ensure compliance with Canadian health information management standards and regulations? Option A. Inform the physician that due to the high volume of requests and the lack of prior relationship, access will be delayed until standard processing times are met. Option B. Grant immediate access to the complete record as requested, assuming the physician's statement of emergency justifies the disclosure without further verification. Option C. Verify the physician's identity and their affiliation with the healthcare facility. Then consult the organization's policies on emergency access to health information to determine the appropriate disclosure protocol. Option D. Provide the physician with a summary of the patient's condition based on available information, without granting full record access, to balance privacy with potential clinical need. The correct answer is C. Verify the physician's identity and their affiliation with the healthcare facility, then consult the organization's policies on emergency access to health information to determine the appropriate disclosure protocol. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent tension between the need for timely access to patient information for clinical decision-making and the imperative to protect patient privacy and comply with stringent health information management regulations in Canada. The HIM professional must navigate these competing demands, ensuring that any disclosure of information, even for seemingly beneficial purposes, adheres strictly to legal and ethical standards. The challenge lies in interpreting and applying the relevant legislation, such as provincial/territorial privacy acts and federal legislation like PIPTA, where applicable to health information, to specific clinical contexts. Correct approach analysis. The correct approach, which involves consulting the organization's established policies and procedures for health information disclosure, is best professional practice because it directly aligns with regulatory compliance and ethical obligations. Canadian health information management is governed by a complex web of federal and provincial/territorial legislation. Organizations are mandated to develop and implement policies that reflect these legal requirements. By adhering to these policies, the HIM professional ensures that disclosures are authorized, documented, and meet the specific criteria outlined in the law, thereby safeguarding patient privacy and avoiding legal repercussions. This approach demonstrates due diligence and a commitment to responsible information stewardship. Incorrect approach is analysis. One incorrect approach would be to grant access based solely on the requesting physician's verbal assurance of urgency without verifying authorization or purpose. This fails to comply with privacy legislation, which requires documented consent or a legally permissible exception for disclosure. It bypasses established safeguards and creates a significant risk of unauthorized access and privacy breaches, violating the ethical duty to protect patient confidentiality. Another incorrect approach would be to refuse access entirely, citing privacy concerns without exploring legitimate avenues for disclosure. Privacy is paramount. Health information legislation often includes provisions for access to information necessary for patient care. An outright refusal, without considering these exceptions or consulting relevant policies, could impede patient care and potentially violate the spirit, if not the letter, of the law regarding access to health records for treatment purposes. A third incorrect approach would be to disclose the information to a third party without confirming their identity and their legal right to receive it. This is a direct contravention of privacy laws and ethical principles. The HIM professional has a responsibility to verify the legitimacy of any request and ensure that the information is only released to authorized individuals or entities under specific, legally defined circumstances. Professional reasoning. When faced with a request for health information, a HIM professional should employ a structured decision-making process. First, identify the nature of the request and the requesting party. Second, consult the organization's policies and procedures for health information disclosure, which should be based on applicable Canadian health information management legislation. Third, determine if the request falls under a legally permissible exception for disclosure, e.g., consent, legal obligation, medical emergency. Fourth, if disclosure is permissible, ensure all necessary documentation and authorization are in place. Fifth, if there is any doubt or ambiguity, seek guidance from the organization's privacy officer, legal counsel, or senior HIM management. This systematic approach ensures compliance, protects patient privacy, and supports effective patient care. Question 19. Risk assessment procedures indicate that a healthcare organization has experienced an unauthorized disclosure of personal health information due to an employee error. The information disclosed includes patient names, dates of birth, and basic diagnostic codes. While the disclosure was accidental and the employee has been counseled, the potential for this information to be linked with other publicly available data to identify individuals and potentially cause embarrassment or minor financial inconvenience exists. Considering the reporting requirements under Canadian health privacy legislation, what is the most appropriate immediate next step for the health information management professional? Option A. Conduct a detailed risk assessment to determine if the unauthorized disclosure poses a real risk of significant harm to the affected individuals, and if so, proceed with mandatory notification to the Privacy Commissioner of Canada and the affected individuals. Option B. Document the incident internally and monitor for any signs of misuse of the disclosed information before considering any external reporting. Option C. Inform only internal stakeholders and senior management about the incident, as the disclosure was an internal error and not a malicious external attack. Option D. Immediately report the incident to the Privacy Commissioner of Canada and all affected individuals, as any unauthorized disclosure of personal health information requires mandatory reporting. The correct answer is A. Conduct a detailed risk assessment to determine if the unauthorized disclosure poses a real risk of significant harm to the affected individuals, and if so, proceed with mandatory notification to the Privacy Commissioner of Canada and the affected individuals. Explanation. Scenario analysis. This scenario presents a common challenge in health information management where a potential breach of patient privacy has been identified. The professional challenge lies in balancing the immediate need to investigate and contain the incident with the mandatory reporting obligations under Canadian health privacy legislation, such as PIPEDA, Personal Information Protection and Electronic Documents Act, and relevant provincial health information acts. The complexity arises from determining the scope of the breach, assessing the risk of harm to individuals, and adhering to strict timelines for notification to both affected individuals and regulatory bodies. Misjudging the severity or failing to report within prescribed periods can lead to significant legal penalties, reputational damage, and loss of public trust. Correct approach analysis. The correct approach involves a thorough and documented risk assessment to determine if the incident constitutes a breach of security safeguards that poses a real risk of significant harm to individuals. This aligns with the reporting requirements under PIPEDA and similar provincial legislation. If such a risk is identified, the organization has a legal and ethical obligation to notify the Privacy Commissioner of Canada and the affected individuals without unreasonable delay. This proactive and compliant approach ensures accountability, allows individuals to take protective measures, and upholds the principles of transparency and data protection central to health information management. Incorrect approach is analysis. Failing to report because the breach was internal and not externally malicious. This is a regulatory failure. Legislation typically does not distinguish between internal and external breaches when assessing reporting obligations. The focus is on the impact on individuals and the risk of harm, regardless of the source of the breach. Delaying notification until a full internal investigation is complete, even if initial findings suggest a real risk of significant harm. This is a failure to meet the without unreasonable delay requirement. While thorough investigation is important, it should not unduly postpone notification if the risk of harm is evident. The legislation often allows for provisional notification followed by more detailed information as it becomes available, reporting only to internal stakeholders and not to the relevant regulatory body. This is a significant regulatory and ethical failure. Provincial and federal privacy laws mandate notification to the designated regulatory authority when a reportable breach occurs. This oversight undermines the oversight function of the regulator and prevents them from fulfilling their mandate to protect Canadians' privacy. Professional reasoning. When faced with a potential privacy breach, health information management professionals must follow a structured decision-making process. This involves 1. Immediate containment and preliminary assessment. Take steps to stop the unauthorized access or disclosure and gather initial facts. 2. Risk assessment. Systematically evaluate the nature of the personal health information involved, the number of individuals affected, the likelihood of misuse, and the potential harm, e.g., identity theft, discrimination, reputational damage. This assessment must be documented. 3. Legal and regulatory consultation. Consult relevant legislation, PIPTA, Provincial Health Information Acts, and organizational policies to determine reporting obligations. 4. Notification. If the risk assessment indicates a real risk of significant harm, proceed with notifying the affected individuals and the relevant regulatory authority within the mandated timeframe. 5. Remediation and prevention. Implement measures to address the root cause of the breach and prevent future occurrences. 6. Documentation. Maintain comprehensive records of the incident, the risk assessment, all notifications, and remediation efforts. Question 20. Assessment of the appropriate course of action when a specialist requests a patient's complete medical record for review, and the patient is not currently under the direct care of that specialist for an immediate treatment decision, requires careful consideration of privacy legislation. A health information management professional receives such a request from a cardiologist who wishes to review the complete record of a patient who was recently treated by a general practitioner for a non-cardiac issue. The patient has not explicitly consented to this cardiologist reviewing their record. Option A. Disclose the complete medical record to the cardiologist without seeking any consent, as they are a registered healthcare professional. Option B. Provide a summary of the patient's condition to the cardiologist, as this is a less invasive disclosure. Option C. Disclose the complete medical record to the cardiologist, assuming implied consent for information sharing among healthcare professionals. Option D. Obtain explicit consent from the patient before disclosing any of their personal health information to the cardiologist. Correct answer is D. Obtain explicit consent from the patient before disclosing any of their personal health information to the cardiologist. Explanation. Scenario analysis. This scenario presents a common yet complex challenge in health information management, balancing a patient's right to privacy and control over their health information with the legitimate need for that information by other healthcare providers involved in their care. The challenge lies in interpreting the scope of implied consent for information sharing within a healthcare team versus the need for explicit consent for broader disclosures. Navigating this requires a thorough understanding of the Personal Health Information Protection Act, FIPA, in Ontario, Canada, and its implications for consent. Correct approach analysis. The correct approach involves recognizing that while implied consent generally covers information sharing among healthcare providers directly involved in a patient's care for the purpose of providing that care, the request for information by a specialist not directly involved in the immediate treatment plan, and for a purpose beyond immediate care coordination, necessitates explicit consent. FIPA emphasizes that individuals have the right to control their personal health information. Therefore, obtaining explicit consent from the patient before sharing their information with the specialist for their review and potential future treatment is the best professional practice. This aligns with the principles of informed consent and respects the patient's autonomy over their health data, as mandated by FIPA. Incorrect approaches analysis. Assuming implied consent is sufficient for sharing information with the specialist, even if they are a registered healthcare professional, is a regulatory failure. FIPA distinguishes between information sharing for direct care and other purposes. While the specialist may be involved in the patient's broader healthcare journey, the request for information in this context, without direct involvement in the immediate treatment decision, falls outside the typical scope of implied consent for information sharing within a treatment team. This approach risks violating the patient's privacy rights and contravenes FIPA requirements for consent. Proceeding with the disclosure without any attempt to obtain consent, based on the assumption that the specialist has a professional right to access the information, is a significant ethical and regulatory failure. FIPA clearly outlines the conditions under which personal health information can be collected, used, and disclosed. A professional's right to access information is not absolute and is contingent upon lawful purposes and appropriate consent. This approach disregards the patient's fundamental right to privacy and control over their health information, leading to a breach of FIPA. Sharing only a summary of the patient's condition without the detailed information requested by the specialist, while seemingly a compromise, is also an incorrect approach. This is because the specialist specifically requested detailed information for their review. Providing an incomplete picture may not adequately serve the specialist's purpose and could lead to misinterpretations or incomplete assessments, potentially impacting the patient's care. Furthermore, it still involves a disclosure of personal health information without the necessary consent for the specific information being shared, even if it's a summary. Professional reasoning. Health information management professionals must adopt a proactive and patient-centric approach when handling requests for personal health information. The decision-making process should begin with identifying the purpose of the information request and the requester's relationship to the patient's care. A critical step is to determine whether the request falls within the scope of implied consent as defined by FIPA. If there is any ambiguity, or if the request extends beyond direct care coordination, the professional must err on the side of caution and seek explicit, informed consent from the patient. This involves clearly explaining what information will be shared, with whom, and for what purpose. Maintaining a clear audit trail of consent obtained and disclosures made is also crucial for accountability and compliance.